Hi everybody, how's it going? I'm great. I'm still here, still kicking it. Had a lot of people ask, how are you doing? How are things? I'm getting there. This last treatment, my sixth treatment, went as to be expected. Same side effects. My biggest complaint from my last chemo and like the last couple of chemotherapy treatments is the neuropathy in my fingers. I'm going to lose fingernails. They're my nail bed is dying, and anytime I put pressure on my fingertips, it's painful, like holding things, grabbing things. I can still do it, but it's not comfortable at all. And I don't know if you can see that, but like the tips of my fingers, I've had to cut my nails way back, and that pink part is almost like where it's the most painful. It's like my fingernails are gonna come off. I've already lost a couple of toenails, and to me that's just gross. It's just icky and gross, and I don't like it. And I mean, you use your fingers for everything, so when I'm typing, and it's painful, it hurts, so that's not fun. Yeah, but like my eyebrows, I got a couple left hanging on by a thread. My eyelashes are doing okay. Those are still holding on tight, so I'm hoping that now that my chemo is done, my hair that I want to grow back will grow back. And you know what's really weird is I still have arm hair. Like we talked about I still have arm hair. It is still there. I would have thought like that would have gone, but no. Here we are. It's the hair that you don't want to keep that you keep, and it's the hair that you want to keep you don't keep. And your fingernails. Ugh. So I had my clip placement appointment, and I'm gonna explain this as best as I can. I was scheduled to go in to have my clip. It's a GPS clip. When you have a biopsy, they take a big long needle and go into the affected area and pull out a sample of the tissue, send it off to the lab. They then insert a titanium clip. It's like, my understanding, it's smaller than a grain of rice, but it's titanium, and you can see it on an ultrasound or like your mammogram, maybe even like when you go through security. It's titanium. You should be able to see it. So I go to my ultrasound appointment to have this new GPS clip inserted into the lymph node area as well as the tumor site. And I am laying down, and the technician is ultrasounding. She's like, did you say it's on your left side? And I'm like, She's like, okay, well, I'm not finding it. And I'm like, how does one lose a titanium clip that is inserted in their body? This girl, of course, it's me. I did it. So she's trying to find it. I can't find it. She goes to the breast to find the titanium clip, and she can't find that one either. Can't find anything. I'm thinking, what does that mean? Like, what does that mean for me? She goes out, gets the radiologist comes in. He starts doing an ultrasound. He can't find it either. He can't find the clip, he can't find the lymph node. What does that mean? So then he goes to the tumor site. He can't find the tumor site clip. He can't find a sign of the tumor. What does that mean? What does that mean? What that means is those 6 treatments of chemotherapy that I had worked. They did exactly what they were supposed to do, to the point where they couldn't find the tumor on the ultrasound. Like, holy shit. How amazing is that? I'm like, miracle. I asked the ultrasound technician, have you ever seen that before? She's like, no, I haven't. I'm like, how long have you been doing this? She's like, 15 years. Okay, tooting my horn a little bit. Because I was not sure, like, what does that mean? They can't find it? Like, did I go through this for nothing? Am I dreaming? Is this April Fool's coming back to get me now? Like, catching up? I wish that were the case. It's not, because it's still all real. However, they couldn't find it. They couldn't find the lymph node that I had the clip placed in that they thought was, an issue. And they couldn't find my tumor because it has shrunk so much that they couldn't find it. We are talking a 3-centimeter long tumor is just gone. So kudos to my body for kicking that ass. And yeah, it's crazy. So my radiologist still has a job to do. He still needs to insert this GPS clip into lymph node placement where he thinks it's supposed to go, based off of pictures from months and months ago that I had done at the Sauk Prairie Clinic in hospital. So he brings up a picture of my ultrasound on his phone to put next to the ultrasound machine to try and find that area to find the lymph node and the clip. He thinks he can see the clip. He's not 100% sure. It's kind of a guess. He says to me, if you were my mom or my wife, what I would do is this. And he says, we're going to go off of this picture. I'm pretty sure this is the area. We're going to place the clip. I'm like, you're the radiologist. I don't know. It all looks wavy and gray and black to me. Like, whatever. That you should know what it looks like. I trust you. Put it where you think it should go. So he does that. Inserts the clip. Now, if you've ever had a biopsy before or clip placement, it's not pleasant. There is nothing fun about that. Thank God for lidocaine that they like numb it with the needle that goes in, but man, that does not feel good at all. Biopsy sucked. That also sucked. So since they can't find my tumor because it's shrunk so much from the chemotherapy, instead of having a ultrasound guided needle to find the tumor site, I have to have a mammogram. Mammograms are not fun either. Either is having a mammogram with a needle inserted into your boob. That's not fun either. However, he thought he could find the clip using mammogram and then was able to squish me in the mammogram, hold me in place, take the needle and insert it into my boob to place that GPS clip where he thought that the tumor was and where the other original titanium clip was. That hurt. You want to talk about painful? That hurt. However, he thinks it's in place where it needs to be. He was successful in putting that clip into my body. I also had an appointment to go see my surgeon and follow up with her. And he had to call her on the phone while I was still there to let her know, like, we can't find this tumor. Like, we can't find this lymph node. So we're kind of guessing here. And she says, it's fine. Go ahead. Do what you got to do. Send her my way when you're able to. We were very late for our appointment because it took me so long with them because they couldn't find it. I mean, they were searching. So we get to my surgeon appointment. It's a quick 5-minute appointment with my surgeon. She's like, do you have any questions for me? I'm like, no. Matt had a few questions. We had already talked about what the surgery looks like for me. And so her nurse came in and, gave me some pre-surgery guidance, which I've already had a couple surgeries before, so I kind of knew what to expect. If I back up a little bit, the surgeon actually did say that before there was GPS clips that they inserted, they'd have you do all of these surgeries anyways, and they just take out, the tissues and things like that. And, they just, that's how they used to do it. And so she's going to go back to the way that she did it before and check out the site and all of that. So I'm good to go. She did, however, say that since my last appointment with her, things have changed a little bit in the way that they proceed while you're in surgery. My initial appointment with her, or not my initial, but one of my appointments with her, she said that while I was out, they would take out those affected lymph nodes, send them to the lab quick. They'd scan that and see if more would need to come out still while I was out at that appointment or during my surgery. They'd move on to, to the breast area for taking out the actual tumor while they were waiting to get those results. They no longer do that. That was like in July I had that appointment. It's August 21st and it's already changed that much, since I saw her last. She said, so now when you're under, we're going to take out the lymph nodes that I think are the ones that need to come out. I'll take out whatever is left or whatever is there for this tumor that they can't find, and we'll send it off to the lab. We will know the results within a week. If I've got all of the material that I need to remove, great. You don't need to come back, for more surgery. If they find out from the lab that there are more cancerous cells that should probably be taken out or more lymph nodes, I'll have to go back in for another surgery. However, it's fine. She said that there was inconclusive data and I'd rather them know what needs to be taken out versus her just going out and just taking more than what really needs to come out. Especially if I have to have that gross drainage tube. It just icks me right out. Like, Ugh. Gross. It's so gross. I can't even talk about it. It's so gross. I don't even want to know. So I'll be in some bindage situation for like 2 weeks. So I plan on doing nothing for 2 weeks while I'm healing. They've got you like doing exercises and stuff. That's it. I'm not doing anything. I'm taking some time off of work. I'm going to hang out at home. My dog is having surgery, or my dog had surgery. You want to talk about a year? Man, we have just been hit hard. It is our year. With a little black cloud over my house. My dog blew out her ACL. Or, well, it's not an ACL, but it's like that. She blew out her knee. She had surgery in the end of February. While we were on vacation, when I found out that I had this situation or this lump, and she just blew out her other side, so she had surgery today. So yeah, it's been a great year. I don't know that we can handle any more things going on in this house, but I have good news. My tumor shrunk to the point where they couldn't find it. Like, how amazing is that? I couldn't ask for anything more. I wish that I had a little bit more energy. At this point, usually with my treatments, I would be a little bit more. I'm still really tired. But I'm hoping that now that chemo is over, I can maybe get out, do some, I'd say yard work. Maybe just looking at the yard would be great. It's not so hot, so I can go outside and not be maybe bombarded with mosquitoes. We'll see. But as far as what I've got going on here in the near future, I start my immunotherapy next week. It's every 21 days. I can't get away from every 21 days going to the hospital, I swear to God. And then my surgery is the following week. So immunotherapy is on Wednesday, and then the following Wednesday I go back to Madison to get my dye injection. I think it's blue. Anyway, they inject you with dye so they can find those sentinel lymph nodes that need to be removed or addressed. And then Thursday is my surgery, September 4th. And then I got 2 weeks to recovery. So I might be taking some visitors at that time. We'll have to see if I have that gross tube or not. Or how I'm feeling. But I hope. I'm so excited to like move forward a little bit. And I like rewatched a couple of my videos from the past. I sound like a dope. I don't know why I do this, but everybody's reaching out and I appreciate that, and I love the support, and I love that people want to know how I'm feeling, and it's great. I still get that, what can I do? Like, I get that question, what can I do for you? What can I do to help you? I wish I knew. I wish there was something, you know? I wish there was something. And there's not. I can't come up with anything. I mean, like, I have had so many people send me amazing cards and gifts from my Amazon wish list, and just meals, things. Like, you guys, my people, I love you all very much. But I wish there was like this magic little wand that you could wave and make it all better. It's like just the way it has to be, you know? It is what it is. I don't know what else to say about it. I wish there was something else I could say. But we're going. We're going to keep going. We're keep doing it. My friend Gretchen got me this bracelet. I wear it every day. On the inside, it says, keep fucking going, and I love it. So thank you, Gretchen. I have a lot of people in my corner. And if you're watching that, then, you know, you guys are people in my corner too. I appreciate y'all being here. So, I don't want to cry. I'm not going to get sappy. I'd like to go have a nap. But I had some work to do yet today, so that's what I'm going to be doing. But that's my update. Hooray for chemotherapy. Hooray that it did its job. It shrunk my tumors and killed my nail beds and my fingertips and my toenails. You know, if that's what it is, then that's what it is. But it is whatever. Anyway. Thanks, you guys, for all of your love and support. I appreciate you all. And I'll catch up with you. I don't know when I'm going to put on another video, but that's all I got for now. So we'll talk to y'all soon.